This is the most horrific serial killing case in American history. The murderer spent 16 years, killed more than 400 victims. So what is the murderer's motive? What method did he use? How can he kill so many people and can still escape legal sanctions for a long time? Today, we are gonna talk about the latest thriller based on a real case, The Good Nurse. The story takes place in the United States, in a general hospital in New Jersey. Amy, she's the night nurse at this hospital's emergency center. Amy works hard, is kind to others. She is a truly conscientious nurse. This morning at 10 o'clock, Amy has been busy all night, getting ready to get off work. She suddenly feels difficulty breathing. Sitting quietly on the bed in the lounge for a long time, she finally stabilizes herself. It turns out that Amy was recently diagnosed with a heart disease, needs surgery as soon as possible. But she's just a single mother with financial constraints. Raising two young daughters alone, she simply cannot afford the high cost of surgery. Fortunately, she only needs to work in this hospital for 1 year. Then she can enjoy employee medical insurance and paid sick leave. Amy has been serving here for 8 months now. Just has to hold on for another 4 months. She then will have enough time and money for surgery. But according to hospital regulations, Amy cannot let the hospital know about her illness. Otherwise she will definitely be fired early. So Amy could only endure the pain and dare not let other colleagues know that she is sick. One day, the emergency center has a new employee named Charlie. Charlie just jumped here from another hospital. Not only he is experienced, but also his reputation is very good. Like Amy, he works overnight in this hospital, takes care of the patients. In subsequent contacts, Amy notices that Charlie is meticulous in his work. Also a very suitable working partner. Coincidentally, Charlie also had a marriage that didn't end well, raising a pair of young daughters. The reason why he is transferred to this hospital is because he wants to be closer to his ex-wife's residence, so that he can visit his two children more often. They work well together, plus they all had similar marriage experiences. Amy soon takes Charlie as her confidant. The two becomes good friends who talks about everything. This evening, the emergency center accepts a dying patient. Amy and other colleagues take turns to perform cardiac resuscitation for half an hour. They saves the patient's life from the hands of death. But this intense first aid work, a loss sends Amy into a coma. The attentive Charlie notices something strange about Amy. Under his concerned questioning, Amy has to tell him that she has a heart disease. After Charlie learned the truth, not only does he promise to keep Amy's secret, he also secretly takes pills from hospital's automatic medicine machine, so Amy can feel better taking the pills. This is clearly a drug theft violation. If discovered by the hospital, Charlie will definitely be fired. Amy wants to refuse his kindness, but Charlie persuades her to take the pills with peace of mind. It turns out Charlie discovered the automatic medicine machine has a system bug. In normal conditions, medical staff logs into the medicine machine. After selecting the medicine, 2 buttons will pop up, confirm and cancel. If you click OK, the machine will deliver the medicines. Click cancel to return to the selection interface. But Charlie discovered, if he doesn't click on neither confirm or cancel button, and wait for long enough, the medicine machine will automatically deliver the selected medicines. After taking away the medicine, then click the cancel button. The medicine machine will not count the medicine reduction. Simply put, Charlie just got Amy's medicine this way. No one will notice at all. To further calm Amy, Charlie also says, it doesn't matter even if someone discovers his behavior, because compared to hospital rules and regulations, Amy's condition and life are obviously more important. His words moves Amy extremely. The trust between the two has also been further strengthened. Since then, Charlie always takes on more work, so as not to overwork Amy. Sometimes, Charlie even takes the initiative to come to Amy's house to take care of her two daughters. This makes Amy's life a lot easier. This evening, when Amy rushes to the hospital for work, gets some sad news. One old lady who was allergic to penicillin, brought to first aid, suddenly passed away during the day. Amy was surprised when she heard the news, because this old lady's physical condition improved significantly since last night. How could she die suddenly? Despite her doubts, Amy doesn't think much about it. After all, the old lady is 77 years old indeed. However, in the 7th week after the old lady died, 2 policemen suddenly comes to the hospital. They will assist the hospital in investigating the cause of death of the old lady. It turns out that the local health department will check mortality rates across hospitals. The possibility of murder cannot be ruled out, so asked the hospital to investigate the matter thoroughly. In order to prevent the hospital from hiding the facts, the health department also assigned 2 police officers. The 2 police officers involved are Detective Danny and his partner Tim. The hospital's senior officials immediately announced the hospital's investigation results, reported to both of them. After questioning the relevant staff and verification of case data, the hospital finally determined the old lady died of natural causes. There is no possibility of murder, But Danny always feels like it is not that simple. If the survey is very simple, how the hospital spent a full 7 weeks to investigate and issue the results, it's more like the hospital is delaying on purpose. The issue is, now the old lady's body has been cremated by her family. Hospital only provided blood test reports and medication records. Danny and Tim, who know nothing about medicine, there's no way to find out the problem at all. Without any choice, the two has to inquire the medical staff at the emergency center. But during the inquiry process, there are always senior hospital officials present to listen. Even if medical staff noticed any unusual, they dare not disclose it to the police openly. So Danny and Tim has worked on it for a long time, but couldn't get any useful information. When they inquire Amy, the senior management of the hospital temporarily leaves for a few minutes. Danny takes this opportunity, let Amy check and examine the blood report for them. Amy notices the problem at a glance. The insulin content in the blood of the deceased old lady is much higher than the content of C-peptide. Usually, insulin and C-peptide come from the same source and show equal relationship. In other words, the insulin content in human blood will be basically the same as the C-peptide content, but it's not the case in this blood report. There can only be one explanation. She was injected with foreign insulin before her death, but the deceased had no symptoms of diabetes before her death. No need to inject insulin at all. That means, the deceased probably died of an overdose of insulin. In other words, the old lady's death does seem like a murder. Amy's words confirms Danny's previous suspicions. Danny and Tim then go to the medical staff at the emergency center, conducts a detailed investigation. Meanwhile, a male nurse with criminal records catches to people's attention. This person officially just joined the job not long ago. Charlie turns out to be accused of harassing hospital colleagues 8 years ago and illegally broke into the colleague's home, then arrested by the police. Later, it was because the victim wanted to settle the matter. Charges against Charlie dropped, so he escaped a jail sentence. Not only that, over the past 16 years, Charlie has worked in 9 hospitals. He only stayed in some hospitals for a few months, no more than a few years at most. As a nurse, it's extremely unusual to change jobs so frequently. What is even more suspicious is, when the police questions to 9 hospitals about the reason for Charlie's resignation, every hospital refuses, under the pretext of protecting employees' privacy. Because the investigation is not going well, Danny and Tim turns back to Amy, who works night shift with Charlie. When the two visited Amy, they tell Amy directly their suspicions about Charlie. But Amy denies he to police detectives face to face. In her opinion, Charlie has more than 10 years of experience as a nurse. It's impossible to inject too much insulin. It's a rookie mistake. And Charlie is usually friendly to others. Amy doesn't believe that he would do it for no reason at all. Kill an old lady he doesn't know. What's more, the old lady died during the day, and Charlie works night shifts. Therefore, Amy firmly believes that the old lady's death has nothing to do with Charlie. However, after just a few days, another death occurred in the hospital. This makes Amy having a second thought about Charlie. This time the deceased is a young mother, who was seriously injured in a car accident. After a whole night of rescue efforts by medical staff, the mother was already out of danger. She then arrested in an emergency room overnight. Who knows, the next night, her injury suddenly worsened, eventually died. When Amy was checking the blood test report, discovered inside the mother's body was also injected with an overdose of insulin. 2 consecutive patients died from the same reason. Obviously someone did it on purpose. What makes Amy even more uneasy is that she accidentally encounters into a female classmate outside. This person happened to work with Charlie in the same hospital before. This female classmate revealed the shocking news to Amy. In their hospital, it happened many times before. Death from insulin overdose. The hospital's internal investigation team at that time found several saline bags with tiny pinhole. There were excess insulin detected in saline bags. At first, the colleagues didn't suspect Charlie at all. Unexpectedly, soon after the incident, Charlie suddenly resigned. And after he resigned, mortality rate among hospital patients showed a clear downward trend. No patients were dead due to overdose of insulin anymore. What the female classmate said gives Amy a chill down her spine. She then hurries back to the hospital, carefully inspects all saline bags, and fortunately, pinholes were found on several of the packages. After testing, in these saline bags, someone was indeed injected with an overdose of insulin. The pinholes on the saline bag are extremely small. If you don't check carefully, no one will notice at all. Amy is shocked. She immediately disposes these problematic saline bags, then runs to the police station, explains the situation to Danny and Tim. Amy doubts it's a system bug that Charlie uses in the medicine machine. Stolen large amounts of insulin. Then these insulins are injected into the patient's saline bags randomly by Charlie. Because the insulin purchased by this hospital is a colorless and transparent liquid, therefore, it's impossible to notice when mixed in saline. So even if Charlie isn't there, Charlie can also kill patients with the help of other nurses. Now the problem is these are just Amy's speculations. The police have no concrete evidence yet. Amy is thinking of the young mother who just passed away. After obtaining the consent of the family, the police immediately conducts a test on the body. Turns out that her body does contain excess insulin. At the meantime, Amy finds opportunity to quietly retrieve Charlie's operation record on the medicine machine. Record shows Charlie has been selected many times for more insulin doses than normal use. Then click the cancel button. This is obviously him taking advantage of system bugs to secretly steal drugs and kill patients. But this alone cannot be used as evidence for accusations, because medical staff normally cancels medicine collection. A record of cancellation is very normal. Just when Danny and Tim are at loss, the hospital executives suddenly fired Charlie with irrelevant excuse. The hospital is obviously aware of Charlie's problem. In order to avoid responsibility, firing Charlie is the easiest to prevent the matter from being exposed and having negative impact on hospital reputation. In fact, the 9 hospitals where Charlie previously worked also keeps quiet regarding this matter. Even some hospitals would write recommendation letters for Charlie in order to send him away as soon as possible. So that despite his heinous crimes, Charlie can always avoid it from resting. He will find new jobs again and again. Continues his murderous behavior. In order to stop this devil from continuing to commit crimes, Amy decides to cooperate with the police. Tries to get evidence of Charlie's confession. A few days later, she takes a hearing bug with her. Asks Charlie to meet her at a restaurant. Charlie has no double about Amy. He just tells Amy he has found a new job and will go to the next hospital to work. Amy calms herself, talks about the 2 recent deaths, and directly states that after Charlie resigned, other colleagues spread rumors that it's all caused by Charlie. Amy hopes Charlie can tell her the truth, and what is the motivation for doing this. Charlie knows where this is heading. The trust in eyes replaced by disappointment and anger. He doesn't answer Amy's questions, getting ready to leave the restaurant. Seeing the plan fails, Danny and Tim have to temporarily detain Charlie. According to relevant legal provisions, in case of insufficient evidence, police can only detain criminal suspects for 48 hours. That is to say, if during this period of time, Charlie isn't unwilling to take the initiative to plead guilty, Danny and Tim could only let him go. The police detectives take turns to intense interrogation, but Charlie is extremely uncooperative. Only for words out of his mouth, "I can't say." As the interrogation time becomes longer and longer, Charlie gradually becomes impatient. He vents his emotion hysterically, releasing terrifying perverted qualities. However, after venting his feelings, Charlie refuses to say a word again. Without any choice, Danny and Tim have to call Amy to the police station again to help assisting in interrogation. This time Amy tries to talk with sincerity. She asks Danny to open Charlie's handcuffs, then takes off her coat to put on Charlie's shoulders. She first makes an apology to him. Amy said, "I shouldn't have used Charlie's trust to cooperate the police." After apologizing, Amy expresses her gratitude to Charlie again. She believes that Charlie helped her life and work is sincere from his heart. So she couldn't figure how a sweet man could do such a terrible thing. Finally, as a friend, Amy begs Charlie to tell the truth. Perhaps it's Amy's sincerity that moves Charlie. Or maybe Charlie is exhausted of years of killing. He finally confesses to the police his murder. He then names 29 victims, but in fact, according to subsequent police statistics and estimates, the patients who died at Charlie's hands should be more than 400 people. When Amy asks Charlie, "Why did you want to kill so many people?" Charlie just says, "They didn't stop me." The movie, based from a real case, happened in the United States. The real murderer was captured by the police at the end of 2003. Due to a prior plea agreement, the murderer escaped death penalty, sentenced to 11 life terms. Until now, this guy is still in jail. After the case was solved, the prototype of Amy in the film successfully completed her heart surgery, still alive today. As the motivation of committing the crime, the real-life murderer does not give a clear explanation. In the movie, there is only one sentence from Charlie: "They didn't stop me." As for who are they, it is left to the audience's imagination. After all, who can really understand a psychopath who killed over 400 people? That's today's movie. Thanks for watching. See you next time.